Hi, and welcome back to Mindfulness, the channel where we attempt to open up a conversation surrounding mental health in India. Today, we are joined by Ms. Harshita Kaushal, a narrative therapy practitioner who works mainly with children, adolescents, and families. Thank you for joining us today, Harshita.
Thank you. Thank you for having me, Ananya.
So, I really wanted to know, could you just tell us a little bit more about what narrative therapy really is?
Surely. Narrative therapy is a postmodernist form of therapy founded by two people, majorly. Their names are Michael White and David Epstein. And it's a very interesting origin story, actually, because it was founded not only from what mental health or clinical work looks like, but it borrowed a lot from feminism, from civil rights movement, from anthropology, from social work, and also from the lived experiences and knowledges of indigenous peoples, local communities. So what it does is it's essentially a very respectful and a very decentered, in a certain sense, form of therapeutic practice and community work. It helps people to feel like they're the expert in their own lives, and it believes that each person, because of the fact that they've lived their whole lives, they've learned so much, they've had knowledges from their community, from their ancestors, from the things that they've experienced themselves. So that each person has internal resources and knowledges that will always help them through certain difficult situations in finding solutions. What narrative therapy does is it places a therapist or anyone actually in a position where they're influential, but they're not the center, right? So they're not telling you, this is your diagnosis. They're not telling you, that's your pathology. Instead, what they do is try to make meaning together from all of these various sources and come up with co-authored solutions, which means you and I are equal partners in this journey, and we're going to be able to come up with solutions that rely heavily on our lived experiences. Does that answer your question?
Right. Yeah. So
Yeah.
I was wondering, is that where the phrase reclaiming your narrative actually comes from? Because it sounds very similar, Both are about like empowering yourself more.
Yeah, I guess I'm not sure if that's what the origin in terms of language might be, but it has a very similar essence.
Yeah.
Which means that what happens is we grow up, right? We have multiple stories that kind of define us, especially for people that might be that might have different sets of oppressions kind of intersecting, right? So if I, as a woman, I have the privilege of being able-bodied, just as an example, right? Very crude, very basic example. I have the privilege of being upper caste in India, which accords me so much educational opportunities, networking opportunities. So each experience of this success, because of the many, privileges that I might have, will help me develop a thicker story, a richer story about me, that I'm more capable, that I'm able to, have these successes. However, people that grow up with thinly veiled stories, thin stories about themselves, and that can be around their own metrics of success, achievement, inner worth, capability, that gets reduced the more marginalized our identities might be, right? Yeah. So what narrative therapy does is it attempts to analyze and look at these problem stories and situate them externally. For example, if I'm looking at the idea of merit, how does being a woman, just an example, get in the way of me feeling meritorious, right? We think about the glass ceiling, we think about, what might get in the way if we're, going ahead with our careers, what does sexual harassment at the workplace look like, and so on. Yeah. So essentially, it is the linkages of the internal to the external.
Okay. Wow. Yeah. So I was wondering, so in my last interview, we had basically spoken to a doctor who was a specialist in CBT. So that focuses more on the here and the now, right? So is narrative therapy more about like the past and the present, or is it more completely internal, like about you? Because as you said, it's about like recognizing yourself. So is it that, or does it also involve like going to the past and like living through your childhood experiences again?
Definitely. And I'm so glad you asked me this question because, I'm thinking back to my training, and one of my primary influences, very honestly, in my lived experience has been my ex-employer and mentor, Dr. Sharja Sen. So, when she would often talk about it, she'd show us a map very initially before our training also began, where narrative therapy is sort of like a ping pong ball between two walls, right? Where it's constantly looking at the now, but it's ping-ponging between the past, the future, the present. It is also trying to connect these three together. So how does our experience of the past, our various, interactions with culture, with gender, with race, with family, with any kinds of experiences that might bring in trauma, how do these affect our future possibly? And more importantly, what are some things that we would want our future to look like based on the past? So what are the preferred stories, preferred events, and skills that we might want to take forward? A lot of times when we are burdened down by pathology, depression, anxiety, PTSD, what happens, the first thing that goes away is our sense of identity shrinks. So we might not feel as whole a person, very crudely speaking. So what narrative therapy does is it tries to thicken this, right? It tries to help us, it tries to play with memory and time and help us remember and articulate the many rich and varied stories we might have been using earlier. So just because I might feel very burdened down by depression and I'm not able to work, doesn't mean there wasn't a time when I wasn't working. What helped me work then? What was it like for me to get through a particularly bad day? How did I start work when it felt really, really impossible to start work? So that's how narrative therapy also plays with time, memory, past, present, future, and tries to link the three in one go. And unlike other therapies like psychodynamic therapy, psychoanalytic therapy, of course, I also use elements of all of these, and I think all of them are valuable, right? But what they do is that they try to essentialize certain things, which means if this happened in your childhood, that's how it's going to affect you now. And that's how it's going to affect you in the future. So it almost becomes something preventive, right? So if they'll say, hey, if you're stuck at an XYZ kind of a stage, you need to become unarrested in order for you to live a freer life. And therapy is the only way that you're going to reach that.
Right.
Yeah.
Okay. Thank you so much. And I was wondering, so the aim of this channel is to promote awareness about mental health in India, because, it's still a very stigmatized topic. So why do you think that there's still so much stigma in India surrounding this topic? And what do you think we can do to actually get rid of that?
Sure, I think that's a wonderful question. Why is there stigma and what can we do to get rid of that? I do think that accessibility is the first thing that comes to mind. Of course, there's stigma in a whole lot of ways, but the biggest problem I see with clinical intervention is accessibility. So if you have to go for therapy, I don't think at this point, if someone really needs help, people do end up coming to hospitals, right? I've worked in government hospitals in Bombay. I've interned in government hospitals in Delhi. So in the morning, you'll see lines and scores of people standing, waiting to get a parchi, which is a little leaflet that allows you entry. However, what gets in the way of that is the extreme pathologization, dehumanization, and reduction of people that happens in these centers, right? And I say this a little tentatively. So what often helps, the first thing that would help is access. I think the first step to that was the Mental Health Act that came out. It is more of a directive than a policy. But what would definitely help is if, for example, mental health was a part of insurance. If mental health care budget was a part of our annual budget, deliberating how can we allocate resources, how can we make it like we have mohalla clinics right now, right? Which is every kind of district has a clinic for health. So similarly, how can we have mohalla clinics for mental health? In fact, a very interesting research within India has been about integrating community psychology with individual therapy, right? So in a lot of in a lot of religious places, dargahs specifically is what I remember, is that they place psychiatrists inside the dargah because that's one of the places where people come to spiritually and organically kind of rid themselves of whatever ailment they might be feeling. So integrating community psychology with, clinical or psychiatric work is another way. Conversations, of course, but I do think we're talking about it a lot. I just don't know who it's reaching.
Yeah, that's true. I mean, like, I know for a fact that people my age are more open talking about it, but then, I'll have like peers, for instance, who will talk to us about something, but they're too afraid to go to their parents. So what advice do you have for parents to, be more available, to like be someone that their children can go to?
Well, so I'm going to take a more expert position while answering this question. I think the first thing is often, and I realize I've been saying this very frequently, especially during the boards, is listen to feelings, don't listen to what your child might be saying with words, right? Harsh words often hide feelings of being scared, feeling inadequate, feeling really despondent. When we simply focus on behavior, it is a half story. When we go beyond and try to see what the behavior is masking or hiding, then we're able to feel more empathetic and also respond to the problem more meaningfully. So a lot of the times, punishment, setting boundaries, setting really thick and firm regulations might make your child more isolated, but creating space to, just kind of talk, to understand what they might be experiencing behind rebellious, acting out, oppositional behaviors. It's counterintuitive, but you'll come up with a solution faster.
Right. Okay. Yeah. So basically what you're saying is that, as long as parents are trying harder to understand what their children are going through instead of just listening to exactly like, taking it literally, that would help.
So just just as an example, if someone breaks curfew, if someone refuses to go to school, if someone's having a really hard time sleeping, it's not that they don't want to do it. One of the most impactful quotes for me, and I don't remember it exactly, is very simple: if the child can, they will, and if they're not able to, then they can't. So I think just keeping that little quote in mind is often helpful. And of course, if you feel like it's too much, it feels like you're not able to manage or understand or help your child, seek a professional's help.
Yeah. Okay, so Harshita, I know that you have to go. You have a session soon. So I have one last question for you.
Of course. Yes.
Yeah, so I just wanted to know, what's one piece of advice that you would want to give to adolescents, especially during this time of lockdown? Not lockdown, quarantine, sorry.
Yeah. To keep reminding themselves that they're doing absolutely wonderful. Because this is literally a pandemic. There is no roadmap for this. Schools have not gone out of their way to make any accommodations, especially if you are neurodivergent, which means do you have ADHD, dyslexia, are you autistic, right? There is no roadmap for this. We're seeing so many people struggle, not because they're not intelligent, not because they don't care, but because the context does not allow them to function in a way that their brains work best.
Right.
So go easy on yourselves.
Yeah.
And I say this as a human being and a witness more than a therapist.
Yeah. So that's all, Harshita. Thank you so much for joining us. It really meant a lot. It was wonderful speaking to you. Thank you.
You too, Ananya. Thank you.
Thank you.